Welcome to Veterans Health Watch. Most of us know the old saying that home is where the heart is, but unfortunately, some homes are struggling with emotional violence and physical violence. Thankfully, the VA Maryland healthcare system has a program to address this issue and help our veterans live a more peaceful life. Anthony is a Navy veteran who sought help with the VA for experiencing violence. Anthony, welcome.
How's it going?
Great. Thank you so much for joining us. Anthony, I want to first say, please feel free to just share only what you feel comfortable sharing with us, okay?
No problem. No problem.
So let's get started with to learn a little bit about your military history. I mentioned you're a Navy veteran. When did you join the military?
I joined in 2006, fresh out of high school. Maybe the following summer, right out of high school. I was 19 years old.
We know when you're in the military, you're preparing for combat. And even after you take certain jobs, you all go through basic training, you learn how to use weapons. Was that your first experience with violence or the atmosphere of violence, or was this something you experienced at a younger age?
No, it wasn't my first experience with violence or even using guns, if you will. I grew up in Chicago and in a very very bad neighborhood, and so I was. Uh, I've had plenty of opportunities to kind of witness things happen and also just see like very close friends get into certain situations where it comes to violence or like any whether it's like physical or verbal. Yeah.
Mhm. So yeah, so that wasn't your first time witnessing a violent environment.
No, not at all. Unfortunately, not at all.
Unfortunately, I want to bring Lindsay into the conversation. Lindsay, as the intimate partner violence program coordinator, is Anthony's story common in what you see with veterans in the program?
Absolutely. Often we know that people have been experiencing violence or witnessing violence, and also that the military atmosphere sometimes can kind of sort of reinforce the use of aggression in terms of communication. Um, so that's definitely not an uncommon experience. And we know that when we look at kind of rates of experience or use of violence, that folks in the military have higher rates than their civilian counterparts because of a lot of these things that they're exposed to, experiencing things like PTSD, a lot of moving around, combat exposure, things like that. Those can all kind of play a role in the way that violence may show up in their relationships.
And you mentioned moving around. Anthony also said he visited 12 countries. I mean, well, not visited. You were serving in the military in 12 countries, and you saw violence growing up in your neighborhood, and then you were in the military. Do you remember, without going into in depth, do you remember a time in your life or instance where maybe you responded in an inappropriate way and you thought, wait, something's not right here?
Yeah, definitely. I would the first time was it was in basic. Um, I had a real hard time in basic because the basic is maybe like 30 minutes outside of Chicago or 30, 45 minutes outside of Chicago. So I felt like I still haven't left. And also I was 19 and so the idea of someone of authority kind of like uh, dictating my every move was very very surreal. Um, Ironically as well, there's another part of it that really kind of shocked me. So this I'll tell the story briefly. So my whole I'm the only male in my family that has not been to prison, right? And so I've probably visited every prison in Illinois, and I've been in the visiting room. And the uniform that they wear in prison was the exact same uniform that I had to put on. So when I put it on, the utilities, I don't think they wear those anymore, but they're like jean, like, jean colored light blue. And when I put it on, I it was like really shocking. So it kind of put me in a defensive place automatically. So I had to kind of but I kind of, shrink myself down a little bit just to kind of make it through the days. And I caught myself often just like, just kind of, verbally, like, cursing someone out or something like that, just being out of frustration. And in hindsight, I didn't know I didn't realize all these things at the time, but in hindsight, that's what I realized was going on.
What made you seek help from the VA?
Well, it took a long time. I'll say that it took a long time for me to seek help. Um, I really, I really operated under the mindset that if my life is going well and I'm not harming anybody, then everything's okay. But that's not necessarily the case. Um, because I realized, like, I've kind of cycled my whole life through different relationships. It's been hard to kind of stay into one relationship. And I have multiple children by multiple different mothers, by multiple different women. And so that is a sign of that as well. Last year, I met my girlfriend, and she kind of she's been she's been in therapy for like several, like, maybe going on 7, 8 years, and she was pretty much breaking down what was going on with me. And I didn't really understand. I thought she was just, trying to pretty much dissect me, and I was very defensive about it until I realized that what she was saying was very true. Like, it really took someone that was not in my life for a long time to kind of recognize what was going on and be able to convey that message in a loving way. And then she got pregnant, and we end up having she ended up having a miscarriage, and our relationship really kind of went in a different direction. And I realized, well, it was kind of one of those things where it was a recommendation, and then it
Mhm.
became a demand. You
Okay.
need to seek therapy. The first session really kind of blew the doors off of everything. And I really, that really kind of, if it wasn't for, I think if that first session had went any differently, I probably would have not continued. But it was just so powerful and just much needed. And I'm a type of person, I don't believe in coincidences.
So what would
So
you so
yeah,
so so Anthony, you said this therapy session just kind of opened things up for you, and you took
yeah.
some guidance, and you went for it. So what would you say to a veteran who, like you said, you thought, oh, I'm fine, everything's okay, but you knew in the back of your mind something wasn't right, you noticed some patterns. What would you say to a veteran who maybe is in that same situation but kind of hesitant about seeking help? How did the VA help you? What would you say to that person?
There's a specific thing that was kind of told to me, just me trying to find things, find resources, and some I can't remember who said it, but it was like, if you want things to change, if you want your life to change, you have to change the things that you do in your life. And so if if your life isn't the way you want it to be in all facets, there's only one thing you have to address, which is yourself first. And everything stems from that, your decisions that you make. And so it's it's not about whether it's going to make you look weak or it's going to make you look crazy. It's about, what is the goal? If the goal is to fix something that's going on, then that's what matters most. And it there's there it should it's for me, that was enough. That was enough for me to say, okay, I want to change the things. I want to change my life, so I need to change the things in my life. So it's important to seek help. It's also just great, to it was also like very, very freeing as well, just to, kind of let a lot of things that I held inside, and I just got it off my chest. It's there really is no, you can't buy that.
Yeah.
It's really, yeah.
That is great insight, Anthony, from one veteran to another. We're going to continue this conversation and talk a little bit more about the other side of the relationship and the partner on the other side. So Lindsay and Anthony are going to stay with us. We're going to take a little break.
Hi, I'm Lydia. I work at the Baltimore VA and I help the veterans navigate their appointments, and I'm on the team.
When I came back from Vietnam and with all the veterans I knew, most of us knew nothing about the term PTSD. 10 years ago, I came into the VA and I got a mental health evaluation. I started getting counseling in group therapy and individual therapy. My advice to a veteran is don't wait until you're totally in crisis. Go into the VA, seek the assistance of those who can help you, just like they helped me. I'm a veteran. I choose VA. I choose VA.
I want to hear more about the services you offer for veterans. And I know we use different terms. We're talking about intimate partner violence, and there are people who experience the intimate partner violence, and there are people who use the violence. Tell us about the programs you have for those veterans who are using violence.
Yeah, so we have a group therapy program called Strength at Home. That's something that Anthony joined us for. And this is a program that's designed specifically for veterans who are using aggression or struggling with conflict in their relationships. And it's really intended to help, one, kind of understand the way in which trauma or our past experiences show up in our relationships. How can we sort of better manage anger and conflict, and how can we better communicate in a relationship? And now we're actually developing, we're about to start, there's a couples version of the Strength at Home group. So it's for the veteran and their partner to come, maybe when they're kind of both struggling with aggression and verbal conflict. That way they can both members of the couple can come and develop those skills.
You said something really important. We're using the phrase intimate partner violence, but it sounds like violence isn't always physical.
Yeah, absolutely. I think that sometimes that's the idea that we have when we use the word violence or talk about IPV or domestic violence. But really, there's a whole spectrum of behaviors. Sometimes things are verbal or psychological. Sometimes it's insults. Sometimes it's threats. Sometimes it's yelling. Sometimes it can be things like stalking. That aren't necessarily physical violence, but they can still take a real toll on the person who's experiencing them. And we really want to address kind of the entire spectrum of violence and behaviors so that we can try to help make sure that our veterans and our staff and their families all have the healthiest relationships possible.
And how do you help the person experiencing that violence? What services do you provide for that partner?
So we can do things like safety planning. Sometimes a person wants to stay in a relationship, and so we can help them kind of plan and navigate their situation to keep themselves safe. Sometimes they may want to leave, and we can help plan on how to do that in the safest way possible. We help coordinate like navigating the system and connecting to a lot of different resources. Sometimes they're within the VA, sometimes they're in the community, and they can be anything from like counseling and mental health support to legal support, shelter and housing, kind of all sorts of things.
Anthony, Lindsay mentioned, thank you, Lindsay. I'm sorry, Lindsay mentioned the tools or learning how to deal with conflict and using something other than aggression. Can you tell us about an experience you've had since you've been using the services that maybe you were able to reach back and use those tools and help you handle something differently?
Oh, absolutely. The one of the tools was one of the tools was just being empathetic, just understanding what's going on the other side of the conversation or the particular disagreement. Um, and that is honestly helped me tremendously, because I just, you know, from the military kind of teaches you to not complain, and so that sentiment tends to translate into how you believe other people should respond to you. And so I struggle with that a lot, and so that is specifically has helped me out a lot.
Mhm, mhm. Lindsay, Anthony just made a wonderful point about how the military trains you. And tell us a little bit more about, are veterans more likely to experience intimate partner violence, and how does the military background play into that?
Yeah, so statistically, usually we hear that about 1 in 3 women and 1 in 4 men will experience IPV in their lifetime. And data suggests that it might be, the numbers among veterans might be twice that. And there's a lot of different factors that play into it. There is, as I said, sometimes the sort of moving around, being separated from your family and loved ones, that can cause conflict in relationships. Dealing with things like PTSD, other mental health challenges, substance abuse, traumatic brain injury, other kind of exposure to trauma, those can all really play a role, and they can also impact how we communicate. One of the things that we actually talk about in the Strength at Home group is sort of where our communication style comes from. And we do talk about how you communicate in the military and maybe how that's still showing up and how you communicate now, which I think is kind of speaks to what Anthony just said about sort of like you don't complain, and then maybe, you know, in your relationship that's different. So we don't necessarily want to apply that, and so we work on skills about like active listening.
What have you seen on the other side, Lindsay, from the partner who's now with a person who had this military training or this background, and they're looking at it as this is just how you do things? What have you seen from the person on the other side?
You know, sometimes it can be really difficult, because I think sometimes if you're not the person that had those experiences, it can be hard to relate and really see where the veteran is coming from. And then sometimes the partners of veterans struggle a little bit, even if they're experiencing things that, you know, maybe to an outsider might be clearly like, well, that's not okay that, you know, someone talks to you that way or treats you that way. But because they know that the person experienced trauma, it's hard to kind of push back on it. So sometimes it's really about, you know, again, emphasizing what is a healthy relationship, and that there's help available for the veteran if they are struggling with things like trauma. And it doesn't necessarily make it okay that they're using violence in any form against you.
Can you give us what a veteran can find in these programs, the veteran or the spouses? So what kind of services do you provide?
Sure. And I do want to emphasize too, we help veterans and their partners as well as VA employees. So we're kind of unique in that respect. So as we talked about, we have services for people who are experiencing violence. We do screenings in the clinics to help identify those folks. We can help with things like safety planning. We can connect them to resources within the VA and the community to help with things like shelter, financial support, to help with legal issues and counseling and support that way, as well as kind of whatever unique needs come up. For veterans who are using violence, we have our Strength at Home group that is a 12-week therapy group for veterans. And now we also have a couples version. So if there are couples, veterans, and their partners who are struggling with conflict in their relationships, we have a 10-week version of the group where both members of the couple can come work on those skills.
This is fantastic that we are addressing this real issue and not sweeping it under the rug. Anthony, and you've been in the program for a year now, and you mentioned that there's a significant other in your life who was the catalyst for you getting this real help. How has that changed your relationship? Everything that you've learned this program, how has it changed your relationship?
It's honestly been night and day. My approach to conflicts, I'm not gonna say it's 100%, but what I will say is that I'm at least willing to hear her out, and and I honestly take a look at myself to see what is going on my end to cause her to have an issue with something that's going on, which usually what it is. Like she'll have something that he's like, hey, this particular event, it bothered me, and I used to just completely shut it out and just not even hear it. I couldn't even hear the actual words she was saying. Now I can hear what she's saying. I'm still working on my defensiveness, but it's at least I'm able to be open about, okay, how do we get to a resolution, instead of just wanting to throw away the whole relationship, which has been my go-to.
That's fantastic. Just making that progress is fantastic. Lindsay, if for
Absolutely.
any veteran who would want the same help, or maybe a loved one of a veteran, how can they get assistance?
Absolutely, they can call myself or my colleague directly. I cover the Baltimore area. My colleague Caitlin covers Perry Point and the Eastern Shore. And any veterans, their providers can put in a referral to us also for any of these services for the Strength at Home group, or if people are experiencing violence, they can always be referred to us or get in touch with us directly.
Well, thank you again. Thank you again. Thank you both so much for sharing your experience, and Lindsay, for the services you provide for our veterans. And I'm sure you've provided some great information for people to take that next step in their lives.
I work in the Perry Point Pharmacy to fulfill all your prescription needs, and I'm on the team.
I always thought VA only took care of those who got hurt in combat. I didn't fight, and I didn't consider myself a veteran.
I always thought you had to have a service-connected injury or be retired to receive VA healthcare. So I applied online, and even though I'm young and healthy now, VA will take care of me my entire life.
Now I'm getting great care at the VA, and I encourage all veterans to apply. I'm a veteran.
And I choose VA.
VA is committed to diversity and inclusion, and the LGBTQ+ community is an integral aspect of our human diversity. VA has implemented several policies and programs addressing issues facing the LGBTQ+ community, and is helping patients access benefits made available to them. Here to talk about some of those benefits is the coordinator of our LGBTQ+ program, Amy Oliveira Sanchez. Welcome, Amy.
Thank you.
Amy, I'm sure some veterans don't know that there's an LGBTQ+ program or coordinator. Could you tell us about your role?
So my role is really to be an asset and a resource to veterans and also to staff in implementing and teaching about new policies, helping veterans find resources they may not be aware of, and doing outreach to encourage LGBTQ+ veterans, that's really a mouthful, to come to the VA if they don't already.
And you mentioned you work with clinicians, and that's important that the clinicians are also educated about this community and how to better serve their patients. Tell me about what you do with the clinicians.
Yeah, absolutely. And in fact, we try and do education for all staff, not just clinicians, because we really want to keep the VA as a welcoming and affirming environment to LGBTQ plus veterans. So often I will do a staff meeting with a different team or a lunch and learn. I might put out materials as I receive them. Just any kind of update I can to train our staff on how to really make LGBTQ plus veterans feel welcome and comfortable here.
And I notice as an employee, I get those messages, and we also get messages from the secretary of the Department of Veterans Affairs. Why do you think it's important from this kind of inclusive messaging to come from the top?
Well, I think it really sets the tone for the whole VA to hear that from the very top of the VA, and in fact, even higher than that, the president, who's our ultimate executive, are supportive of LGBTQ plus rights, and that including them and providing the care that they deserve is a really important part of the VA mission. So it not only lets veterans know that we're here for them and that we want to serve them, but it also, again, reminds the staff that that's a standard that the VA is holding itself to.
Absolutely. And with that standard comes services and programs for this particular community. Tell us more about some of those services that veterans can expect.
Yeah, we're expanding those every day as well. We offer a lot of services already that veterans might not know about in regards to particularly transgender care, which has been a very important topic in the last few years. We provide services right now that include hormone treatment therapy, prosthetics, vocal coaching, as well as mental health resources. Unfortunately, we don't currently provide surgery for gender affirming care. However, it has been made a policy that we will begin doing that in the near future. And in fact, we actually have a member of the VA Maryland staff that is on the national work group planning on how to roll that out. So that's really exciting. It's something that's a long time in coming for the VA to offer to our veterans. In addition to that, we hold events. We're really active in Pride celebrations. We do outreach. We have groups. So there's really a wide array of services that we offer, and we're hoping to keep improving and increasing those services. So, any veteran that has something that they want that isn't here is definitely encouraged to contact me, and we can start talking about how to put that in place.
Great. Thank you, Amy, for your time. I really appreciate it. And we appreciate all you do for the LGBTQ plus community. If a veteran is interested in the services or needs help, please contact Amy on the information you see on the screen.
I make the VA Medical Center safe for its employees and the patients, and I'm on the team.
Remembering everything you need to do after your VA appointment can be overwhelming. That's why the VA has developed a new tool to help you keep track. Meet Annie. Annie is an automated messaging app that uses instructions from your doctor to help you stick to your personalized care plan between appointments. Annie sends reminders and other helpful messages directly to your phone or other devices. Respond to Annie with a simple text or through the Annie app. Your responses are available for you and your VA care team to review at any time to track your health goals, encouraging you to take an active role in managing your health. Remember, Annie helps you record your health, but is not a way to message your doctor. If you need to send a secure message to your VA care team, please continue using My Healthy Vet. Talk to your provider today to see how you can use Annie in your care plan. To learn more, visit the Annie app for Veterans page in the VA App Store.
This wraps up this edition of Veterans Health Watch. If you are a veteran, apply for VA healthcare today. You deserve it. Just visit our webpage for more information.